South Africa's fight against HIV goes back decades. That's now under threat with sudden US funding cuts starting to hit home.
Our government is diligently working to preserve our achievements in the fight against HIV/AIDS. While these accomplishments may be momentarily jeopardize our programs, we believe we will prevail. We are now concentrating on augmenting our domestic funding, initiating national campaigns, and exploring partnerships with the BRICS nations and the private sector in our country to address the funding deficits.
Over 8.2 million South Africans live with HIV, 78% are on treatment. But now clinics have closed, costing thousands of jobs and slashing testing by 30%.
Not making the diagnosis means that people are walking around without knowing that they are living with HIV, without having an ability to get onto treatment and impact on their health and their longevity.
In February, UN AIDS estimated an additional 1.1 million people needed treatment in South Africa, and finding them is now more urgent than ever. So too is reviving critical research, which has been shelved without investment.
Having other partners like China and India who are innovators, who have great capacity in drug development and vaccine manufacturing are critical partners because they can partner with us and help us build our ecosystem for innovation and improves our ability to collaborate with people who understand our burden of disease.
The World Health Organization has praised South Africa for moving quickly to manage the fallout.
I commend the government for moving quickly to analyze the impact of these cuts and to develop and fund contingency plans for each province. These challenges also bring opportunities, and I commend South Africa for its commitments to strengthen domestic funding for HIV and tuberculosis.
But AIDS advocacy groups have called for greater government commitment to ensure communities are not further burdened by the fresh crisis.
There are a lot of inequality issues that are not addressed in our communities. There are a lot of issues of poverty that are not addressed. But when you go to seek help, then you are judged, you are stigmatized based on your background, which it's not fair. So that is why we feel like the PEPFAR funding was closing those gaps. Yes, it was not 100%, but it was covering a lot of people.
South Africa's goal to end AIDS as a public health threat by 2030 is caught in a funding storm. New treatments may offer hope, but only if policies, investment and delivery reaches those most in need. Julie Shar, CGTN, South Africa.